Hi, I'm Dr. Mascaro, Advanced Back and Neck Care, and we're here today to talk about spinal curve angles and the importance of having correct curves in the spine. Most people think that the spine should be straight, and that is correct. If you're looking at the spine from behind, this would represent the base of the skull. The brain sits here, spinal cord runs right through the center of this, and out between each two of the spinal bones or vertebra, these yellow things, and they would be representative of the spinal nerves. So from behind, the spine should be straight. However, from the side, it's normal to have three curve angles in the spine. This would represent the neck area. There are 7 bones in the neck, and the curve angle in the neck should be a little bit forward. This is representative of the mid or upper back, or the area where the ribs connect, or the thoracic spine. There are 12 bones here, and the curve angle should be backward. And then this is the low back, and the curve angle should be forward again. So again, 3 curve angles that should be within a certain tolerance to decrease stress on the spinal structures. We often find that over time, with injuries, forces of gravity, things that we do in front of us, the spinal curve angle in the neck will oftentimes flex forward or straighten. This can put a tremendous amount of stress on the discs, ultimately affecting the nerve roots and pulling on the muscles that attach over the neck to the upper back. In this office, we do a technique called chiropractic biophysics, which is oftentimes extremely successful in restoring most, if not all, of the natural curve in the cervical spine. And we do it with a specific technique of manipulation, and also we use a instrument called a regainer chair. This is a regainer chair where we do cervical spine extension. Okay. So this model spine, as you can see, the cervical spine has been straightened, and when we do this with a human being, basically what we do is the area where the curve angle is straightened, we'll have them lie back, head would be back here, and eventually over time the ligaments would move forward, and the goal is to creep the ligaments back over time to form a normal curve angle such as this. So here we have a model patient that we're going to use to demonstrate this technique. It's very simple, very gentle, and we start out with just a short period of time when we begin this technique with our patients. I'm going to have you just lean back, and I'm going to cradle your neck here. I'm going to sit this underneath your cervical spine, and I'm going to allow your neck to just come backward like so. The objective is to use the head weight to bring the ligaments forward. It's called ligament creeping, and over time we increase the amount of time that we keep our patients on this, with the objective of changing and improving that curve angle, and oftentimes it's extremely successful. I'm going to help you up now. Was that comfortable?
Yes.
Okay. Thank you. This video is brought to you by Dr. Mascaro, Advanced Back and Neck Care Center on Long Hill Road in Groton, Connecticut. Thank you for listening.